Tom Hancock is faced with an agonizing decision. What began as a small infection in his foot now threatens his life. He's had every treatment modern medicine has to offer, but they've all failed, forcing him to make one final choice: amputate his entire foot or let starving fly larvae feast on his flesh. You're looking at the smallest surgeons on Earth. Tiny creatures that can burrow their way into places even the finest scalpel can't reach. This is maggot therapy.
Maggots have a number of beneficial effects on wound healing. Their primary and most important action is actually cleaning the wound, removing all the dead tissue.
Tom Hancock, a patient at the Doncaster Royal Infirmary in England, has suffered from type 2 diabetes for years, and his disease has taken a hideous toll.
This black mess on my foot, like gangrene. I can't imagine maggots doing any good at all.
Ever since World War I, the British medical community has embraced the use of fly larvae as an alternative to amputation. Today, the maggots are bred in a special lab specifically for medical use. Sue Johnson, a clinical nurse specialist in wound care, will perform the maggot procedure on Tom's foot.
Okay, we'll get started then.
We'll remind you of the obvious. This is not for the squeamish.
Oh my God.
I think you'll see a big improvement when we've had the maggots on. It'll clean all this area up. But probably these two toes, we'll lose those two. We'll try and keep the third one for you.
Now Nurse Johnson pours the 100 or so maggots onto the sterile netting and places it right on top of Tom's open wound. If they can't save his foot, it will have to be amputated. There's one more catch. If not removed in 72 hours, the maggots will turn into flies. For Tom, the wait seems endless. Can these maggots save his foot? Finally, after 3 days, it's time to see how well the therapy worked.
Right, Tom.
Yes.
What I'm going to do now is just take these bandages off.
Yes.
And then we'll see what the maggots have actually done.
The maggots have consumed a large amount of the dead tissue. They have also eaten the bacteria along with it, increasing their size 5 times. It sounds agonizing, but Tom says it was painless.
I haven't felt them crawling and creeping.
And look, they're actually burying right down underneath. So it might take us a little while.
The most important step, every maggot must be removed before closing the wound.
Clean this second toe up a little bit. They certainly had a good feed, haven't they?
Yes.
Fattened up quite a bit.
Yeah.
The maggot therapy has worked. Nature's microsurgeons have accomplished something a scalpel couldn't. Tom's foot was saved. And with a little assist from Nurse Johnson, he's finally on his way home.